completed it at a sort of version 1. And Hussein will go through a little bit more of the history, but just to sort of remind us all about why this is an important tool, is because what it has done for the sector is it's created a common framework for how we describe the circumstances around sheltering, and provides a sort of common language for us to discuss it and to provide humanitarian services for sheltering. The 3 pillars were the main innovation for this product, and the way that we define how we support how people live, both within their homes and within their communities. So the 3 pillars, to remind you, are the pillar 1 is the thing that we live inside. Some of us call it a house, some of us call it a shelter, some of us call it a home. But that physical, tangible asset that we live inside that separates the inside from the outside. Then the pillar 2 is that the qualities of living your domestic life inside your home, and roughly equates to, how do you sleep, how do you cook, how do you eat, those functions that happen inside our homes. And then the third is the community space, as we all sort of know. And we are at the point now of using it where we need to understand how well this is suiting purpose. Is it working for you? Where are the challenges, and how do we evolve it? Because we don't see this as as an endpoint. This is the beginning. This is how we want to change it and make it adaptable and suitable for your needs. And we can go through it more in the discussion at the end, but maybe I'll hand over to Hussein now. And thank you, Hussein, for pulling this all together.
Thank you, Neil, and welcome, colleagues, for this special coffee break. As Neil said, I will walk you through a quick presentation for 10-15 minutes, and then we will open the discussion to reflect on these topics related to the SSC. So basically, starting with a quick recap, as we know, the SSC analytical framework has 3 main parts. First of all, on the background, the context where our shelter responses are happening, then the 3 pillars, as Neil explained them, related to the shelter, living conditions, and the settlement. And the 3rd component is the impact of the shelter conditions. So looking forward of the impact of shelter needs, the impact of not meeting those needs, and the impact of meeting those needs in the long term. Then here, just a quick overview on the 3 pillars. In overall, what are we looking out of these 3 pillars? That people have can live with dignity and security of tenure in adequate dwelling, house, apartment, whatever we call it, with sufficient access to community level services and infrastructure. As you know, the SSC is to mainly serve the point of measuring the severity of the shelter needs. For this purpose, we have classified the severities into 5 scales, from minimum up to catastrophic. And for each one, they range between people can live adequately in their homes or in their shelters with good level of access to services, up to that in catastrophic, a full collapse of services, collapse of shelters, and so on. With definitions of these phases at household level and at area level, considering that we are using somehow the 20% threshold here. So if we distribute 100% of the population over the severity phases, so to be in severity 5, at least 20% should be living in that severity, and so on. In severity 4, it's 3 and 2 and 1, etc. We sum up to that level of severity. Coupled with the severity levels and with the 3 pillars, we have defined 3 main indicators for each pillar and sub-indicators through which we were measuring the severity of needs and the people of needs calculation through the MSNA data, basically, or any other data source that we were having last year. So basically, these indicators were mostly to inform our data collection, our data analysis, whether it is household level data collection or data set, or area level, or some key informant, or some observation, or any other data source that might be available at the country level. The implementation steps, they follow this timeline. So defining the information needs, basically this is to adapt and contextualize the indicators and sub-indicators to the country context, starting the data collection, working with inter-cluster community, with the interagency community on defining who will be responsible for the assessments and so on. Mainly in most of the countries where the SSC was implemented, we have seen that either MSNAs or DTM in some cases were used as the main source of data for the SSC analysis. The third step where we do, as Shelter Cluster community, the SSC analysis based on the primary data source that we have, and reviewing the results with our cluster members, and producing finally the shelter needs overview, including the severities, the PIN, and the summary of those needs in a qualitative manner. Usually, this timeline follows the HPC cycles, the HNHRP, and it feeds directly into the GF process that you have seen in during last year, and you will see it again happening this year. But last year it was a little bit kind of compressed due to the launch of both the GF 2.0 and the SSC at the middle of the year, and but this year we will have more relaxed timeline to go through the implementation of the full process. Basically, here we're looking at the calculation of the PIN and severity. Just a quick reminder. So we design the questionnaire, we fill the analysis grid, format our data set, assigns severity scores under each pillar for each household, and based on that, we will have automatic calculation to decide or to get the severity of each household, and then the severity per area, and based on that, we calculate the PIN for each area. And the last step is to do some adjustment based on some expert judgment, based on some evidence, based on some secondary data analysis or any other data source that might be available to adjust the findings that are coming out from the quantitative analysis. We have provided the calculation model based on some Excel sheets, mainly consisting of the analysis grid, the decision tree that combines the 3 pillars together, and the 5 severity phase distribution with some automatic calculation sheets to have the final severity and PIN score and figures. Hopefully, we were hoping to have out of the SSC analysis something called the shelter needs overview. It depends on the capacity in the country, getting only the chapters to the HNOHRP or the HNRP, or maybe having a standalone document called Shelter Needs Overview, informing advocacy efforts, informing the shelter cluster strategy, informing the programmatic planning for the coming year, and feeding into the GF and supporting the cluster into the interagency and intercluster discussions. This was kind of a proposal on how we can organize the shelter needs overview. This is just a quick recap. If you are interested in more details on each of these steps, we have the presentations from last year, and we have as well the recordings are published on the website. So during the rollout last year, as we all know, SSC was launched in May through a webinar, and then we had a series of training sessions starting in June. We have 2 training sessions, and then we had the coordination workshop where we have some scenario-based experimentation on how the SSC can be implemented in 3 different scenarios. Then during between August and September, we had more sessions to have a deep dive, technical deep dive, and those sessions were organized in English and in French. We tried to address during those sessions the main aspect of the SSC and the main questions and concerns of the colleagues, especially during that period that the SSC was started to be implemented in the different countries. During the rollout in 23, we had 14 countries implementing the SSC. The list is on the slide, and we had 2 countries implementing methodologies similar to the SSC because they had those methodologies pre-developed there in those countries. They were mostly alike the SSC. Some other countries implemented different methodologies defined in different ways, but we hope that more countries will start to implement the SSC in this year. After the implementation, like during the time between October and December, we started to conduct some lesson learned exercise. That exercise was mainly through one-to-one interviews during the monthly calls that the global coordination team has with the country clusters on a monthly basis, and through our own personal experience as the IM team from the global cluster was deployed into some countries and directly implemented the SSC in those countries. For example, in Somalia, we had that experience ourselves because we didn't have a dedicated IMO in the cluster in Somalia. This feedback was organized as best practices, some challenges, and some recommendations coming out of those rounds of discussions and interviews, mainly focusing on the relevance of the SSC, aspects on the methodological components of the SSC, the implementation process, the tools that were provided or made available, and the overall GSC guidance, the training, and the capacity building processes. The feedback that we have received, overall, it was positive feedback. I mean, I'm listing here from the text that we were collating together. Overall, it was good feedback. It is the first time where we have a standardized framework. It was seen as a thinking enabler to start discussing or thinking around the shelter needs. Many of the countries appreciated the ability to contextualize the SSC, though it is a standard methodology. The tools were really good to a great extent, I can say, based on the perspective of the colleagues. Then I hear someone. Someone can just to mute. Okay. A key area for improvement that we have seen is to improve the Excel skills, because the tools we provided were Excel based, and that was really one main area for improvement. there were some issues on the ping capping and the severity reductions that we usually face with OCHA in the inter-cluster community, based on some political agreements, based on some other agreements happening in the countries. SSC didn't help clearly in overcoming those challenges or pushed back from OCHA, for example. That was mainly due to lack of communication or active communication on the SSC or advocating for it as a standard methodology. And this was understandable, as it was the first year we having this framework, and we started to enforce our communication on that direction. On the challenges that were identified, there were mainly 4 challenges that they were highlighted on how to implement the Pillar 3 in relation to the community level services or access to services and so on, and how to avoid overlap with other clusters, etc. Then how to apply the SSC in data poor contexts, in area level data contexts. For example, when you have the data at the area level, not at the household level. We have some training sessions on that, but still need to be reinforced. The third challenge that was identified was how to include additional proxy indicators to support the analysis, or to challenge the analysis that we are getting from our primary data source. The last one was on how to integrate better the HLP indicators or information within the SSC without having that overlap with protection cluster or the HLPA or in general, or CCM cluster from the other side. On the recommendations that we have received, mainly to reinforce the communication around the SSC, we're trying to work actively on that, refine some theoretical and conceptual components, especially, as we said, related to the Pillar 3 and how we understand the severity of needs and what are the needs, and these kind of defining components of GSSC, to update the guidelines and the calculation tool to address the challenges and the best practices and the recommendations that were provided, design a comprehensive training, and we will work on that during the coming months, to work with partners to ensure the shelter sections in their assessments, in their questionnaires that they implement on their own are aligned with the SSC, and this will happen between us at the global level and your teams in the country, the coordination team in the countries, to ensure that mainstreaming is happening into the partners' assessment tools. And finally, to consider digitalizing the SSC by providing an online platform where we can just plug in our data, and we will have the analysis happening there without using or the necessity to use an Excel sheet for that analysis, knowing all the complexities, the heaviness, the prone to mistakes in Excel, and will allow us to have better quality assurance on the process as well. Last week we have sent a quick survey just to get some, to test the scenario on how, based on your experiences in implementing the SSC, how do you see the SSC as a framework, as a methodology being used to inform the analysis of shelter needs? Overall, we have received good feedback. As you see, the results are more or less on average on almost 3.5. Availability of data to inform each of the pillars. We have seen that the Pillar 3 received means the lowest score here at 2.9. We would like to make more space here to discuss how we can avail more data or collect better data to inform the SSC and see how the SSC can be more relevant to the shelter needs. Overall comments that we have received, appreciating the continuous support. There was some like a bit of confusion on how the SSC can be implemented at the individual level, household and location or area level. Advocacy for contextualization, even at the severity scale level. Seeing the SSC as a good step forward, but needing more guidance on how to consolidate the three pillars together to get the overall severity. And this slides back to the decision trees that we have in the SSC tools. And then we have one comment saying that the SSC is not contextual to the country cluster and not involved in the PIN calculation with lack of coordination. This is the presentation. I'll keep the slides shared here, but we will open the floor now for any comments, any discussions, any questions that you might have out of this. I don't see any hand raised. I don't know if it's in the nor in the chat. I don't see any question. I mean, maybe if I can start from this comment of the survey, I don't know who, because the survey was anonymous, if anyone who responded with these comments or didn't respond to the survey would like to elaborate more. Patrick, please.
Thank you very much, Hussein. My name is Patrick from the Northwest Syria cluster. Just a few four points to just raise. One is some of the challenges that we faced was a lack of adequate data to measure indicators for the three pillars, more specifically household data. And this was mainly due to access limitations in some areas and lack of MSNA data in some of the hubs. But of course, we did one thing you've mentioned there, using proxy indicators. In some of the hubs, you'd find that we had data, but other hubs did not have data. I would say maybe going forward, as a cluster and the Syria hubs, we should ensure that MSNA questions for the shelter cluster to be structured in a way that they measure these indicators for the SSC going forward. And I think, of course, it came in midway in the middle of the year, so we had to use whatever we have. We used whatever indicators we had, but it was quite useful, especially harmonizing across the three hubs. The second point is we recently conducted a household survey, and we utilized the pillars in the SSC in our assessment. It was quite useful. It was a perception survey to assess the impact of the dignified shelters that we had done. So we asked questions using these indicators, and we found it quite useful. It was specifically for advocacy. One challenge that I can note is some of the indicators. We found that some indicators cannot be assessed through perception survey. Some might need scientific measurement. For example, the level of thermal comfort. Some might need, checking whether a shelter is locked, etc. So not all questions are, or not all indicators can be measured through household assessments. The third point you've mentioned is on harmonizing methodology for the weighting. This one on consolidating the three pillars to get the overall severity. That one I had shared. Because at the end of the day, we would want to compare severity of administrative areas as a consolidated shelter severity. So if some guidance can be obtained on that, it would be good. And lastly, I can say that this SSC was quite useful. It is, it gives us a structured methodology of the HPC analysis. More so for us in Syria, we were moving from project-based to hybrid costing methodology, and this was quite useful for us. Thank you.
Great. Thank you so much, Patrick. Neil, I saw your hand was raised. I have a couple of follow-up questions to Patrick as well, but please go ahead.
No, I thought that was really useful information, and I guess I have a general question related to some of the comments that you made. I know that many of the contexts that we're trying to implement the SSC are particularly data poor. And not every context is going to have the same amount of data, and some are unfortunately quite lacking, and because of access or other reasons. And I'm wondering about the range of data sources that we have available to us, and whether there's any comments or any suggestions from country level about it. I know that the MSNA tends to be, you know, the primary source of a lot of the data because of its, I guess, its presence in most of the countries, and it's, you know, sort of, it's been designed to sort of support the GF process, and that tends to be what we lean on. But I guess I'm wondering whether how many country contexts have expanded beyond the MSNA, how many have gone through an exercise of trying to acquire maybe something more detailed or shelter specific through other methodologies, or has there been any exploration of maybe other proxy indicators that could be gathered through other sources? Just a sort of question. But I thank you, Patrick.
Yeah. Great, thanks, Neil. Actually, I will just raise the question from the last point you made, Neil, on the proxy indicators and what are other data sources that can be available in the country. So if you can share with us the proxy indicators you used in Northwest Syria, just for us to kind of create a bank of indicators or a bank of data sources that can be available, and try to maybe mainstream somehow these processes, because there was one of the challenges on how to, you know, use some proxy indicators to inform the SSC. I'm really curious here to know how you utilize that in your surveys. And the other one on the comparability of the severity between different areas here, like related to the comment from the survey, that to have the severity scale contextualized, how do you see about using an absolute severity scale, that it is a global severity scale, and or versus using a relative severity scale at the country level? Just as a debate point or a discussion point that we can maybe carry on while moving forward. Emma, I see your Patrick, please go ahead.
Yeah. So let me start with some of the initial questions on other ways beyond MSNA that we are working on here in Northwest Syria. It's we initiated towards the end of last year a series of assessments where we jointly work with cluster partners to do assessments. So we design questionnaires and we deploy partners to do the assessments. And we found this quite useful. We've done 2 so far, and this is detailed assessments. One of them is the one that I mentioned to you, where we were assessing the impact of our dignified shelters. And we agreed as a cluster that we will continue working on this. It's really it's cost effective because you're utilizing the resources that we have, and the ownership is quite high. On how we worked on proxy indicators, one of the hubs did not completely do an MSNA, so they had to utilize data from the previous years and did some computations. I think the IM colleagues who are here can share a bit more on that, but they had to try to do that to be able to find computations for, find some of the indicators. We also had to rely on data from other clusters. For example, CCCM cluster that does monthly assessments, as well as I think twice a year they do some thorough assessments in the camps, in the IDP camps, on whether we can have an absolute or one modality of consolidation. That one, I'll leave it to you guys as the experts, but I would say having such an absolute way would be easy for comparability between one country to another. And I think it would be useful for us. Thanks.
I'm muted. Thank you, Patrick. I'll keep the points for discussions as well. I mean, for any colleagues to reflect on. But I will give you the floor to Emma now. Sorry for making you wait that long.
No, thank you very much, and nice to meet you all, and thank you very much for holding the session. So it's Emma Matthews, Shelter and NFI Coordinator for North East Hub for Syria. So many of my points are also very aligned, and I think, fit nicely with the conversation that's ongoing. Yeah, I mean, firstly, thank you very much for the creation of this tool. I think it's been hugely helpful for us in our strategy development and also, through the HLP process as well. And it's really detailed, and I think, the pillars make a lot of sense and what's been included. I think I would like to really second a bit of the conversation that's been going on in terms of sources of data. For the North East Hub, we're very, very reliant on MSNA. We don't have a lot of other alternative data sources. And I think what's been particularly challenging for that is being able to identify those on a shelter severity scoring of 5. So traditionally, kind of with the normal MSNA methodology, those households don't end up being included because they're too dangerous for people to be able to undertake their surveys, or they're really hard to be able to identify. So for us, I think that's been, one of the gaps that I think would apply over quite a large number of contexts as well, that is definitely important to consider and look for where alternative sources can be used and what the quality of the data is like to actually be able to implement that. And then, actually, my other point was also in terms of comparability. I think, this is particularly interesting for Syria, where we end up with a country overview where directly the 3 contexts kind of automatically end up getting compared, when actually some of the conditions are quite different and the humanitarian response looks quite different across those 3 hubs. I had some concerns throughout this whole process, and I know it was noted very early on that the SSC shouldn't necessarily be comparable because different data sets have been used. And I do think that it's important, and I would like to advocate kind of for more awareness of that, and actually for less of a kind of comparable scale to be put in, recognizing that, of course, there is some need for global comparison. But what also I think concerns me is the involvement of this then in the HRP process, where we do see direct comparisons being made anyway. And I think that how that works for next year would be something that maybe requires a bit more understanding and a bit more exploration into, to ensure that we're not giving a false impression to donors, and also appreciating, right, that MSNA is pretty high level data and it's not necessarily reflecting the ground realities and all of those needs. So and I think also, sorry, in regards to MSNA data as well, and Patrick also touched on this, but we really struggled with the fact that the MSNA tool wasn't quite well suited to the SSC. So there were really indicators missing that didn't allow us to get a proper understanding of the pillars.
Thank you so much. I'm taking notes of the points. I see like the issue of the comparability even within the same country, where we have different contexts, different conditions that are behind the shelter needs, and how we can ensure that we are not giving false impression to donors, whether we are just inflating the severity or undermining the severity of the needs in both directions. So that's where the absolute or a global standard of the severity comes as an important point, but still needs to be really kind of having a deep work to contextualize that understanding or that framework somehow at the country level to produce results that really talking to the global standard. I see Ali and Neil raise their hands. Ali, you can go first, and then I'll give you the floor to Neil afterwards. Ali?
Yeah, thank you, Hassan. Thank you, Neil. Actually, we had a challenge when we applying the 20% rule, especially for the area level analysis, because when we applying the 20% rule, the pen was very exaggerated because for example, for locations with severity 5, we had to take 100% or 80% of the population in need. So we came up with an exaggerated pen. And so we had to reduce the percentage in order to come up with a logical figures. Yeah, about you.
Thanks, Ali. Neil? I see you smiling.
Well, yeah. A few things. I don't want to talk too much. That's part of my problem, but I will. Can I just talk about that point for a second? I think we recognize that the SSC is, well, at least the way I describe it, it's a bit of a sausage grinder. It's a mechanism for taking the data that we have available and smushing it in through whatever algorithms that we choose, and we can choose like that 20-80% rule is part of the calculation, but that can be adapted however it makes sense for your context. But let's also recognize that this is based upon the data that we have, not necessarily the data that we need. So it's always, going to be a best guess at, well, it's an approach at sort of structuring our thinking around the problems. And I don't think it's intended to be absolute truth as to the number of people that, are in need. It's supposed to be our best guess based upon what we have. So I think what you did there by adapting the 20% rule for your context makes absolute sense, and that's exactly what we hope that you would do. So that's great. And then I wanted to come back to, I think it was Emma, you were saying some really interesting things about comparability between countries, and that the hair on the back of my neck always stands up when we have this conversation, because I find that potentially quite dangerous. And the utility of using the SSC as an advocacy tool for donors, as part of that message of how we communicate to donors, advocating for our country compared to all of the other countries in the world that are also advocating for the country. I think this is maybe a good topic for a future coffee break. And I wanted to sort of plant a seed with everyone on this call, because one of the next things that we need to do is revise the fact sheets. And the fact sheets, as they relate to the messaging from the country level about what we're saying that the needs are and what the funding situation is, and the number of people that we're saying are in need, the percentage of funding, the disaggregation by geographies and by pillars, all of that stuff, as how do we standardize that so that it appropriately reflects the advocacy positions of your countries? So I just sort of wanted to sort of open that door that we do need to have this conversation. I think it's a really good conversation to have. And it's a super opportune time to have that conversation, because we are actively thinking about how the fact sheets get changed to suit your purposes. Because right now it's I wouldn't say it's even in a completed version 1 form. It's a sort of placeholder as a concept. So let's collectively build on it together. Over. Thank you.
Thanks, Neil. Yeah, we already have the topic for the next one, SSC as an advocacy tool. We'll see how we can tackle that point and work on it. Adriana?
Yes. Hello, Hussein. Hello, Neil and colleagues. Yes, just to tell you a bit of the experience that we have in Venezuela with the Shelter Severity Classification tool. So in our case, the tool came just in time to incorporate in the MSNA the proper questions to have the key indicators that we needed for the calculation. So it was in the limit of time, but it was good enough for us to incorporate these indicators in the calculation. And I think 2 things that I would highlight is it gave us a structured thinking around the shelter severities, and this also gave us credibility on how to present the severities and the calculations through the process. So it was very, very useful for us. In our case, we used additional indicators, local indicators. We don't have a lot of data here in Venezuela. We have a lot of limitations, but we managed to get some additional information to adjust the severities. So we had a resulting severity from the Shelter Severity Classification, and we incorporated additional information to have our modified or final severity. So this is something that we could do. And also we had an additional procedure that helped us contextualize the result, which was the discussion with experts. So we had the whole results of the calculation, and we had together with OCHA and all the clusters here in Venezuela, discussions with experts with the results. Because sometimes the numbers are not, are the best that we have at the moment, but sometimes do not reflect the realities like in every region. So the discussion with experts was a final step to also refine the calculations that we had. I would say that one of the most important challenges that we have is that we underestimated the complexity of the Excel file, because at the beginning we were feeling what indicators we needed for the calculation, but then we have very limited time to do the whole calculation. So it was really a big challenge. We did it. I don't know how, but we did it also with the help of Hussein behind us. But it was really challenging. And yes, that would be our experience, and I think looking forward for this year to also continue to improve the process. Over.
Great. Thank you so much. I'm glad that you managed finally to meet the timeline that you had, even with the limited resources and the complexities. The good thing that I really like from what you explained to us, Adriana, here is there is a process that you took the results of the analysis and you went hub by hub or region by region, and you discussed with local experts and to inform your analysis or to adjust your analysis with some locally available data or perspective, etc. And this is really a very good practice. This is an excellent one. The other one is bringing the analysis in a transparent, open manner to the intercluster community and start to compare and discuss and reflect with the other clusters if our data is really reflecting the reality or not. And that is another, excellent best practice that usually from now on will happen in within the GF process. I mean, it will happen that intercluster community together to do some analysis or cross-check or peer review somehow, if you would like to call it like that. So these two steps, actually having the local or subnational reflections or consultations, this is amazing experience, and being open to the intercluster community and discuss and reflect on with other clusters is an great one as well, but it is within our commitment to the GF process as well. Emma, I see your hand up as well.
Yeah, thank you. And it's just a reflection on that. I mean, obviously with the whole of Syria process, we effectively went through that, in that the initial kind of calculations were done by whole of Syria, and then at the hub level, we went through the peer review process with support from partners. Just what I would say to this was the challenge that, because of a bit of a lack of data, but also I think a lack of support and guidance really at the maybe global level and in kind of this methodology being the first year, it wasn't kind of clear how we could then go back to the initial process to then include more data or different data to then change those outcomes so that it reflected reality. And what instead we kind of ended up happening with this kind of random process where you reduce the overall totals for each area to better reflect reality, but which then obviously means you've got an output in the end, which doesn't, it's not statistically very accurate and kind of undermines in effect the whole methodology and going through this process. So I think, some greater support on how, when we do have that peer review process, those changes can be implemented in a kind of good way and in a, effective way, that would be really, really helpful. Also, what was my other reflection? I had another reflection on the process as a whole. So obviously, I think the only issue with adding, or one of the main issues as well with adding the SSC to the HRP and HNO process is that it added an additional level for our partners to understand, which was quite complicated for a lot of our partners. And I think it meant that, for some of them, it meant that they couldn't really engage with the data, and they actually were less able to understand the process than they have been in previous years. Obviously, that's, with the clusters to do proper training and on us to do proper training to make sure that the partners are properly included. But yeah, it did end up with kind of this very complicated process over quite an extensive period that became very, very hard to properly explain and to discuss with partners as well.
Great. Yeah, again, I mean, I'm glad that these subnational discussions are happening more in different places. I would like maybe to highlight on the last point on how to mainstream the knowledge of the SSC and the knowledge of the data that we're collecting to the partners. We would like to hear more about this point, actually. It's important how we can organize wider trainings, wider consultations, etc. The best way that works for you and your partners, so we can support with that. We can work together on this point to make this knowledge available down the stream to the partners, because they are the ones who are collecting the data, especially in the case of Northwest Syria, as Patrick mentioned, with those rounds of assessments run by partners. That's really important point, to have this knowledge mainstream to the partners. Laskuni, please go ahead.
Yes, thank you, Hussein, for the floor. And so from DRC, I'm Laskuni Sokia from DRC, Democratic Republic of Congo. So we have no lesson learned to share, because we didn't apply the SSC last year. but we plan to to use it this year when it will be about the next HRP HNO, because the SSC is mainly for the HNO. So this coffee break helped us to improve our planning, because we understand that there are several challenges in terms of process, especially because what we need is to have a light process, because we know when it's about the HRP or HNO, there are OCHA requests, there are several activities around, and what we need is through our SSC, we can have our PIN, and also to make sure that the process is, as I mentioned, is very, very light. And I highly appreciated the experience of Venezuela. I think I will reach out Adriana to better understand how they deal with the SSC. But through we will need more support of the GSCs. Hopefully we have Anga who is with us in mission in DRC. So I think this year or next time when we talk about the lesson learned, DRC will share more experience on that. And we have assets. We already organized some assessment in the field, and we work jointly with REACH through the MSNA. I think we will integrate easily the SSC in our PIN methodology calculation. So, all right, thank you.
Great. Thanks, Laskuni. Just maybe starting from the last point on the integration of the SSC into the MSNA as indicators or questions. We did this exercise with REACH at the global level to include some sample questions that they will inform the SSC indicators, but you need to do this at the country level to contextualize those questions, the options of each questions, what really makes sense to your context, and so on. So great that you are in having those consultations with REACH at the country level. I would encourage as well those cross-country experience sharing. I mean, and we hope that this platform of the Coffee Break, fosters these experiences and practices. Please let us know if you need any support on those cross-country sharing. I see Emma's hand as well. I don't know if there's something in the chat before I give you the floor, Emma. Is something there? Okay, there's no questions there. Thank you, Esam, for your comment. Emma, please go ahead.
Hi, sorry for the continued feedback. I think the other thing that, just came to my attention was the difference between the shelter cluster and other sectors. So I think, with this process, we ended up with a really, much more accurate outcome than maybe some of the other sectors had. And kind of category 5 in Shelter Severity Classification, it's what it should be, right? It's really those people that are most in need. However, kind of looking at other clusters in the final HNO process, it was kind of clear that they were using maybe slightly different levels. And I don't want to get too caught up in the HNO and HRP. I know this is a bit separate, but I think, this is also something to continue to consider for the next year is, ensuring that we don't kind of undervalue the SNFI needs against kind of other sectors, because we have such a rigorous process, and how we can advocate for others to better also include that within their cluster.
Okay. Great. Thank you, Emma. I just, with the respect of time, we still have 3 minutes. Frederick, your hand is up next.
Yes, so thanks, Hussein. So I think I want just to talk about the cross-country experiences. So this is a good, I think, approach that we are going to insist more for this year, as yes, there are countries that did very, very well. So the other countries can really borrow from that. Then generally, I think the experience was very good. Me coming from the global level and also supporting a country. I think it was the SSC really worked very well. The fact that it could, borrow from different sources of data, and then the 3 pillars approach was a little bit excellent. Then the only challenge I think you're saying about is we had a challenge in one of the countries where we used the SSC to calculate the data. Then the pin was a little bit higher than what they actually thought it would be. So I think this is one of the challenges that you're going to face maybe this year or when you're using the SSC. So how do you handle that? Because then some of the cluster coordinators come and say, we know this location, the numbers cannot be this much and everything. So it's important for us as IMs to, of course, stand on our ground, have belief on what the SSC can do, and provided you follow the methodology to the letter, then you at least know you're sure that you're going to get the right pin, provided you use the right approach. Thanks.
Great. Thank you, Frederick. Yeah, indeed. I mean, this like we need to ensure that we get as accurate as possible results from the SSC, but involving as well the cross-checking with the like the coordination team, the partners, other experts that are available at our in our clusters. Just before we, I don't see any hand up. I don't see any question in the chat. I would like to call for 3 things actually here. First, if any of you can share with us any proxy indicator being used within the SSC or outside the SSC that is available at your in your cluster that you are using somehow, and why you are using it, how you are using it, with some explanation. So the list of proxy indicators that you are using in the countries. The second question is the data sources that you have at the country level. MSNA data, household level data, DTM, any social economic data set or study, whatever data source that you can utilize or you feel that it is accessible for you, please share that list with us. We would like to know more about that. We did an exercise, bilateral exercise on that, but we need to know more about the available data sources at the country level. Third thing, if you would like, you can share with us 1-pager about your experience, 1-word page about your experience with the SSC, and we will utilize these 1-pagers as a communication practices or communication tools to advocate for the SSC and advocate for your country experience with using the SSC in the country. So highlighting your experience, how did you feel about the SSC as a methodology, the things that you were sharing with us, the challenges that you face, etc. But in 1 page, specifically 1-word page maximum. Anyone who would like to do that, please share with us, and you can reach out bilaterally to more details. Something in the chat came in here. Okay, someone has to leave, but I will go back to you, Neil, to close this coffee break.
Yeah, just I think that there's some interesting next steps that we can take. One that I can think of is more of a detailed mapping and availability of the indicators for everybody to see what other countries are using, and it might stimulate some conversations in other countries. This conversation around data preparedness, or I think all of the countries are at this stage now where they're knowing that the HNO season is going to be coming up. Maybe we should have a conversation around how to prepare ourselves for the upcoming HNO season and the next iteration of the SSC. I would like to have a conversation at some point about fact sheets and advocacy. So there's lots of interesting threads that we can pull just following from this conversation, and yeah, thank you all for your participation. I get a lot out of this, so thank you. for your time.
Yeah, indeed, it was really interesting. Thank you, Neil. Thank you, colleagues, and we hope to hear more from you on the SSC. Thank you, everyone. Have a good
Thanks.
afternoon or good morning.
Thank you.